Hello again, everyone, and welcome to this installment of Practice Perfection web-based educational series. I'm Danny Bobrow, President of AIM Dental Marketing. Tonight's presentation is entitled The Third Era of Medicine, and we are indeed fortunate to have Charles Chip Whitney, MD, as tonight's guest presenter. Chip is a board-certified physician in family practice and sports medicine and is CEO of Revolutionary Health Services, a known leader in the field of concierge and collaborative medicine. He is also the current Vice President of the American Academy of Private Physicians. We've invited Chip today to draw upon his 20-plus years in the field of concierge medicine to demonstrate how third-era medicine is revolutionizing medicine and dentistry. I first met Chip during my work in helping found the American Academy for Oral Systemic Health when AOSH and the AAPP became sister organizations. It has been a true pleasure and privilege to have the chance to work closely with Chip in delivering an efficient and effective revenue-based patient health coaching and wellness model, and that is exactly what we plan to share with you this evening. As usual, we expect the presentation to run for about an hour, during which you are welcome to submit your questions using the question button on your screen. We will do our best to get all of your questions answered, if not during this evening's webcast, then shortly thereafter. I am joined this evening by my life and business partner, Virginia Norton, who will present this evening's attendee poll questions, as well as field your questions during the presentation. With that, it is my pleasure to introduce to you Dr. Charles Whitney. Hello, Chip.
Hello, Danny. It's great to talk to you again, and I'm thrilled to be able to present the webinar tonight, and I'm appreciative of all of you who joined us to hear what I have to say.
Well, it's our pleasure, and I know it's going to be a fun, exciting, and informative evening. And as those of you who've attended prior webcasts know, we do like typically to start things off by getting a feel for who is in attendance by polling our audience. So I'm going to ask Virginia to present the first poll and ask you to take a moment or two to answer those questions for us. And the question, quite simply, is what is your profession? Are you a dentist, hygienist, non-clinical dental team member, physician, or other? Please take a moment to answer that, and then we'll share the results. Okay, a few more seconds. All right, let's go ahead and close that, Virginia, and see who we got joining us this evening. All right. Hey, we have the hygienists win. We have 31% dentists, 46% hygienists. We've got 15% non-clinical dental team members, 8% physicians, and no others. So a pretty good representative, very well represented by hygienists, which we're pleased to see, aren't we, Chip?
Absolutely.
All right, great. All right. Back to you, Chip. Let's get this show on the road.
All right. Very good. Let's see here. Apologize. There we go. Okay, as Danny said, that's a little bit about my bio, and what I'm going to present and share with you tonight is my passion. About a year ago, I first heard the concept of the 3 eras of medicine, and I immediately realized that I had always been a third-era thinker, and my mindset had been that of the third era of medicine, but I've been trapped in a second-era world. And what I'm hoping to do tonight is to spark a flame in those of you who are like-minded as I am, and kind of stimulate your interest in helping me move our country into the third era of medicine. A while ago, a study was done where they interviewed people who were on their deathbed. these people who are within days, weeks, or months of passing away from a terminal illness. And they asked them, if you could have a do-over in life, if you could change something in your life, what would it be? And the three common answers that they had were they would let the little things go, they would invest more into relationships in their life, and they would look to leave a legacy. And like Robin Sharma says, no one expects to live forever, but we would love to live a legacy that does. And the legacy that I'm looking to leave in my career legacy is to be instrumental in leading our country into the third era of medicine. So what this graph here shows is it shows what we're all feeling. Healthcare expenses are astronomically rising in our country. The insurance premiums are rising typically 10 to 30% every year, and that's been happening for several years now. Most of the time, the insurance companies are getting blamed for that, but the reality is it's because the cost of health care is rapidly rising too. And the insurance companies are simply asking for the money to pay for the expenses they're looking to spend, or they're needing to spend. And why is that? It's because we've got a rapidly increasing number of sick people needing to use a rapidly increasing number of very expensive surgeries, technologies, medicines, testings, etc. And as you can see by the graph here, that this increase is not sustainable. They're predicting by the year, this is from the United States GAO, the Government Accounting Office, is that by the year 2044, the amount of spent per year on health care is going to equal that collected in taxes from the entire country. This has got to change. The World Economic Forum in 2010 republished a report showing that there are 8 behaviors, risky behaviors, that drive about 15% 15 of the most common chronic conditions that account for 80% of the total cost of chronic illnesses worldwide. So it's just a very few number of risks that are leading toward that. I heard Michael Royce of the Cleveland Clinic say one time that 80% of diseases are driven by our lifestyle choices. And if you look through those list of 8, there's really only one of them on there that's changed significantly in the last 10 or 20 years, and that's the risk or the problem of obesity. We really have an uncontrolled epidemic in our country that's really ravaging the health of Americans everywhere. The CDC, Center for Disease Control, in 1988 started to look at the problem. Prior to that, it wasn't an issue, and even as of '88, you can see that about a third of the states here, the ones in white, weren't even looking at obesity. But as the years have passed, from '98 to 2008 to 2010, the amount of obesity in our country was rapidly rising, so that by 2010, over a third of the states, 30% or more of the population was obese, which was way more than it was just 2 decades prior to that. Recently, I saw a report from the CDC saying that they're estimating that 36% of Americans are now obese countrywide. And unfortunately, although obesity is considered a social problem, it's actually, at the core, it's a health problem. Overweight and obesity will, by the time a person is obese, most of the time they're insulin resistant. Insulin resistance is the disease mechanism that ultimately will lead to diabetes, and it's thought that a person about 17 years after they cross into obesity, many will develop diabetes. And then after diabetes comes vascular disease and other obesity-related illnesses like cancer, Alzheimer's, and several others. So that those are where the game changers occur, where it severely impacts a person's life and is impacting the economic health of our country, because that rapidly rising number of obese people are driving the diseases that we're having to pay for. Duke University earlier this year published a report estimating that by the year 2030 there's going to be 32 million more obese Americans than we have now, and that up to 11% of the Americans are going to be severely obese, a level at which they would be a candidate for bariatric surgery. And isn't this sad? Unfortunately, we all are aware that obese parents lead to the lifestyles of obese children, and this young man is going to have a terrible future unless he changes his course, because he's probably already insulin resistant. In a relatively short number of years will be diabetic, and I'm predicting that in the next couple of decades we're going to see a dramatically change and shift in the age at which people are starting to have a lot of these diseases like cancers, heart attacks, and strokes. This is a 1921 Bentley. It is a beautiful vehicle, but you don't see many of those around anymore. The problem is that with a lot of vehicles, whether it's this or more modern vehicles, that the owners don't take care of their vehicles very well, and they rust, their parts wear out, and they end up dying at a young age, and in the case of vehicles, they end up in the junkyard. Well, there's a pretty strong analogy to the vehicle we drive and the vehicle that we own in our bodies. This is a model. It's not a data-driven model. It's a conceptual model that shows the current and projected health path. It's basically showing that at birth, most of us are optimally healthy. At death, everybody's sick, and then we all have a health path that goes from birth to death. I've gone in my practice to start to ask questions of people every time they come in for their annual wellness evaluation. I simply ask them the question, how do you envision your life when you're old? I leave up to them what they consider old being, but inevitably everybody says the same thing. Everybody's saying they want a healthy brain, they want to be independent, they want to be event-free, they want to be as active as they want to be. So, and they all make sense. Those are no surprise. So although everybody in their middle ages is saying those kind of things, that unfortunately when you get out to these older ages, let's just say 70 to 80, there's a huge variation in the health of people. That yes, there are people who have reached their goals and they're doing pretty well at an older age, but there's a really large and rapidly increasing number of people who don't reach those goals, and they're developing sickness at these older ages. Yep. And unfortunately the health path is shifting to the left where they're getting these sicknesses at much younger ages.
What I think is interesting too, Chip, is that this little yellow region between the green and the red, people don't realize that there are three states. There's healthy, there's sick, and then there's this middle stage, which is sort of pre-sick, or as you call it here, non-sick. And I think that's the unfortunate reality, is people don't realize that their symptoms haven't manifested yet, but that doesn't mean that they won't.
No, absolutely. No, I mean, once people reach middle age, unfortunately, most people aren't optimally healthy anymore. Not everybody, but most people aren't, but they're not sick yet. So they're generally feeling pretty good. I mean, it's quite often I see people who I know they've got all kinds of disease processes. I mean, let's just take obesity alone. If a person is obese at this age, they've got the oxidative processes going that lead to inflammation, that lead to free radicals, and those are the chemical processes that lead towards very poor health. So if a person is obese at middle age, no matter how decent they may feel, their trajectory is not a good one, and they're on a trajectory so that their older years are not going to be pleasant, and they may be hit at any point with a problem. So
ignorance is not bliss, in other words.
No, it's not, unfortunately. And I'm in my practice trying to identify those at middle ages who are on the path towards sickness and find a way for them to turn around, and that's the point of tonight's discussion. So there's got to be a way to turn the ship around. I mean, the health of our nation is going down the sewer very quickly, and we need to find a way to turn that ship around. So in order to understand how to do that, I'm going to introduce you to the concept of the three era of medicine. And the first era of medicine began at the beginning of medicine, way back whenever. And up and through the end of the first era of medicine, the main goal was to fight infectious diseases. That's what was killing everybody, is that people were having short lifespans because they get an infection and it would kill them. Well, once we got antibiotics, once we got improved public health, once we got immunizations, then we got a grasp on infectious diseases. Then we still fight them, but it's no longer the major issue that we fight. So once Elvis got his measles shot in 1958, we transitioned from the first into the second era of medicine. The second era of medicine is where we are now. This is the era of chronic diseases. About the time Elvis was getting his measles shot, we were having a rapidly escalating ability to identify diseases and treat them through surgeries, whether it's bypass surgery, eventually stenting, cancer treatment, expensive medications, things like that. We were able to, more than ever, once the disease hit us, we were able to treat it adequately. The problem with the second era of medicine is it's a very reactionary model. So the mindset of a physician when you see us, and those of us, I'm 48, and anybody who is practicing now has grown up in the second era of medicine, where the mindset is to find a disease and fix it. So if you go to see the doctor and your blood pressure is rising a little bit, blood sugar is a little borderline, cholesterol is a bit high, what do we tell you? Oh, we tell you to eat more and eat less and exercise more. Well, that's the right thing to do. We know that's the right thing to do for people, but unfortunately, 79% of physicians were never trained adequately in lifestyle modification, so we don't know how to adequately counsel people to do those things. And we don't have the time to. The average primary care visit's been cut down to 6 to 8 minutes in today's modern medicine, so we just don't have the time. So what happens, we send people off to do it on their own. Most people can't do it. They come back to us, and we give them pills. So we are giving a pill to pad the numbers for the blood pressure and cholesterol, but we're not treating the underlying disease process that's causing it, and the inflammation and oxidation is ongoing. So eventually, and then when it comes to obesity, the pills aren't working, and we suggest people have bariatric surgery. So the physicians in our country, through no fault of our own, because that's how we've been trained since the 50s, we're caught up in the web of the second era of medicine, where it's the reactive disease model, not helping a person to create health. We're waiting for the disease diagnoses to happen. We're not preventing the cancer. We're not preventing ever needing a stent. We're waiting for the disease and treating them when they come. And how about this as the model of healthcare? And unfortunately, the model that the physicians have adopted of reacting to disease is now being transitioned over to the patients, and the patients have the model, the pill treatment model, not prescription medications like the physicians do, but I can't tell you how many times in my practice I've had people walk in who are severely obese, who have got this. I ask my patients during their wellness to bring their prescription and supplements in so that I can make sure I know what they're taking. And they'll have this big box load of supplements that they're using to try to get healthy, but not doing what it takes to truly create health. It's just a pill mentality. And unfortunately, we resigned ourselves as a country to accept sickness. We're never going to cure. I mean, the mindset is we're not going to cure our blood pressure. We're not going to cure our diabetes. We hope it never happens. When it does, we're our experts in the country teaching people how to live with their diseases, not how to cure their diseases. Isn't it sad when a 17-year-old is being recommended to have bariatric surgery? I think Albert Einstein said it best. It really, really is insanity when we keep trying to do the same thing over and expecting different results. And when it comes to health in our country, we are not going to be able to turn that ship around of our country. People aren't going to be able to have a better future unless they find ways to create health. So what the third era of medicine is a new health path. We've got to create a new health path for the people who want to go down, to have an opportunity to truly create health in their life. And that's my passion. That's my mission in life. That's the legacy that I want to leave. It's the reason that I volunteered to be vice president of the American Academy of Private Physicians. It would give me the platform to hopefully be the tool to help carry, one of the tools to help carry our country into that third era of medicine, to change the mindset of one from reacting disease to one of creating health. So when you're on that new health path, you'd be amazed at the capacity the human body has to heal itself. In the past 2 years, since I've created my third era practice and adopted a lot of those methods that I've learned through the AAPP, including the one you'll hear about tonight, I've watched countless of my patients to change their course. They're ascending the health path, creating more health, and giving themselves much more of an opportunity for more good years, and in addition, feeling much better for it. I knew it, but I felt it over the last couple of years, just feeling these lives change and watching these lives change as they create health in their life. This is a wonderful poster put together by the Cleveland Clinic Foundation. What they did is they did a study where they took people who were severely with extreme obesity, a body mass index of at least 35 or more, and they reached a healthy weight of a body mass index of 25 or under. So these people truly created health in their life through weight loss. And in doing so, what they found was that, not surprisingly, 82% cardiac risk reduction. they also found 82% of asthma was improved. They also found that 55% of depression was improved. So there's a lot of these diseases that were cured through this person attaining a healthy weight and then maintaining it through developing healthy habits. And you can see in the bottom right box over here, even the 5-year mortality was reduced by 89% through people who successfully accomplished this weight loss. So my mission, to get America healthy. And I say here, we must empower patients to create health, adopt that third era mindset, because physicians are so entrenched in that second era, it's going to take all health professionals to do it. It can't just be the physicians. We don't see patients enough, and we don't have the right mindset. And all health professionals, we shouldn't just be treating the body parts. We need to be treating the person, and treating the person requires helping them to create health. So what was my journey? My journey in creating my third era practice has been a pretty fun ride for the last decade, where in 2003, University of Pennsylvania started me in what I've got now. For those who don't know me, I've got a concierge practice. I take care of a small number of people, and I really help them to give them personalized care. So throughout my first several years, I was doing kind of what we all did and treating diseases and trying my best to help people get healthy. But like all physicians, I was suboptimally trained on helping people with lifestyle, so people really weren't getting that healthy. Well, 2007, I joined the board of 2008, the board of AAPP, and I started to get introduced to a lot of these improved, innovative ways of helping people to get healthy. And my transforming point in my career was in April of 2010 when I met Dr. Brad Bale. He was the developer of the Bale-Knee method of heart attack and stroke prevention. Once I saw that program, I was like a kid in a candy shop when I came back from it, and I felt like, for the first time in my career, I felt like I could make a difference. I could really impact a person's life through his method, and by December of that year, I had fully implemented the program into my practice. Well, April of 2011, about 6 months into doing it, I was seeing several patients who were having this proven disease on testing called CIMT ultrasound. I was looking for the causes of the disease, because the method teaches you to find the cause and treat the cause, but none of them, there was a subset of people who absolutely had no identifiable cause. Well, I remember during the training program, Dr. Bale had a few slides up about the oral systemic connection. I figured, well, it's time for me to learn about this mouth thing that physicians aren't typically taught to look in front of the tonsils, but I figured I had to kind of learn about this because that was probably the source of their problem, and that began my road into the mouth. And it's been a fun ride. For those of you who don't understand, your body part, the mouth, has a tremendous impact on systemic disease. And it was only after I started to learn about this, and I'm helping people to create oral health in their lives through my practice, am I starting to watch some of these people heal their disease. About the same time, actually almost exactly the same time, I met Dr. Mark Nelson. Well, the first 6 months of the Bale-Knee method, I was doing great with the drugs, I was doing great with the supplements, but I was being very frustrated because they weren't very improving their inflammatory markers. They weren't improving and curing their insulin resistance very well because I wasn't effectively helping them to do the lifestyle part, which is the most important part of treatment in the Bale-Knee method. Well, Mark introduced me what you're going to be hearing a little bit later about Take Shape for Life, and I knew immediately it was the plug-in to my practice that I would need it to help people to create health in their life. And for the next 5, 6 months after that, I just watched person after person for the first time in their lives get healthy. So that in September that year, I decided to add being a business coach for Take Shape for Life into my Revolutionary Health Services business plan, which is why I'm talking to you tonight. And Danny has done the same. And my ride with the dentist has gotten kind of interesting, so that in this summer I had a 8-credit continuing education course published in Penwell about heart attack and stroke prevention and how dentists can be impactful in their practice. And in August, an editorial viewpoint that I wrote to Dentistry Today, they published it where I was commenting on the irresponsible colleagues of mine in the American Heart Association leading the public to believe there's no need to take care of your mouth. There's not a lot of there's no proven connection. So I kind of made some scathing comments about my cardiology colleagues on that one. But my point in saying that is that it's introduced me to many, many conversations with the dental community, and I recognize very quickly that dentists are health professionals, and dental practices are health professionals who can use this program powerfully to help their patients get healthy.
Let's not forget, too, that you last month had an article published in RDH eVillage, which was targeted for the hygienists among us.
Nah, that would be true. Yeah, and thank you. I'd forgotten about that.
Yeah, well, some of
They're
them
running together, so
you're doing a lot.
I'm going to get my honorary DDS or DMD here. So just
RDH.
Just like a lot of, honestly, just like a lot of dentists are attending the Bail-Deneen method, and they're learning how to help people get cardiovascularly more healthy too. I mean, there's just such overlap. It's just been so much
It's
fun
great.
to watch.
Well, that's what we want to see, is this interdisciplinary collaboration.
Absolutely.
Keeping the patients.
So why do dentists need to help empower their patients to create health? Well, number one, there is level A evidence, and for those of you who don't know medical research or research very well, that level A evidence is the most powerful evidence that supports a finding, and there is level A evidence that supports an association of oral disease with systemic disease. It's been shown that oral disease cannot be adequately eradicated if a patient has diabetes or prediabetes. A friend of mine, he's actually in my community, just had published in Penwell a beautiful summary article that shows that in order to adequately treat periodontal inflammation, you have to control their diabetes also. And I've had many hygienists tell me that they can't they could scrape a person's teeth every single week, but if they don't get their glucose sugar under control, they're not going to be able to do their job adequately. And as most people are aware, most type 2 diabetes is caused by unhealthy lifestyles such as obesity and being sedentary. And that, as I mentioned before, unfortunately 79% of physicians have never been trained adequately in obesity counseling and don't have the time to do it. So what the dental practice typically does is send their patient back to the physician. The patient's told to eat less and move more. They don't successfully do it, and then nothing gets accomplished. So there's a big need for you to get involved. I'm going to show you now a video. It's a video that shows you heart attack. I'm going to kind of talk through it a little bit in terms of what we're seeing. So this is a heart. The coronary arteries or heart attacks wrap around the outside of the heart, as you can see here, and they supply oxygen to the muscle of the heart. So what we're going to do is we're going to dive inside the artery, and we're going to be a blood cell going through the tubes of the artery. This is a nice healthy artery, healthy walls, everything's flowing freely through a nice healthy artery. Those cells in the wall are the muscle cells that control the blood pressure. The endothelium is the lining. So now we're going to go to another artery where we're going to start to see some disease. So as we traverse through, we're going to see a stable plaque. Not all plaque is dangerous. So you've got plenty of blood flowing through this tube, and there's a plaque there, but there's a nice thick cap, and that cap is not going to cause a heart attack. That's a healed plaque, or people are going to be okay. Now we're going to show a vulnerable plaque. Vulnerable plaques cause heart attacks. Vulnerable plaques are inflamed. They're bubbling, a bubbly cauldron of liquid stuff where the activated white blood cells will move towards the surface, thin out the cap of that plaque, eat its way through, pop a hole in the lining, and when that happens, the clotting cascade kicks in to heal that injury, clots off the artery. That free-flowing artery immediately gets blocked off completely, and that's a heart attack. So yes, you in the dental profession do have the ability to prevent your patients from having a heart attack, and if I ever talk to people in private, I got a story of my patient who I'm pretty convinced that his heart attack death at 44 years old may have been related to his mouth. So yes, there is full reason for you to consider creating a ThirdEra dental practice, just like I've created a ThirdEra medical practice. And I would say it's necessary because most of the physicians aren't doing it, and we don't have the mindset. So what is the value to you to do this? Why would a dentist want to do this? Well, number one, you're going to have improved outcomes because, as I said before, that you can't adequately treat gum inflammation if you've got obesity causing elevated glucose, and I will say that I have absolutely seen inflammatory markers through the roof that plummet when a person starts flossing, doing mouthwash, and just basically taking care of their mouth. Nothing else works. It does much better than a drug does. So you will have proved outcome, and it's not just diabetes, just insulin resistance pre-diabetes will do it too. You're going to get referrals from doing this, completely separate from creating an oral systemic practice. You're going to have a bunch of walking billboards out there. You're going to have people who create health, first step being getting to a healthy weight, and their friends are going to say, how did you do it? Oh, my dentist helped me get healthy. Well, they're going to bring people in your practice. What you'll learn in a little bit is that what will end up happening, the dynamics are that your practice will start coaching clients who aren't in your dental practice. And what will end up happening is they'll be introduced to what you're all about as a dental practice through the person coaching them to health, and they'll be interested in your practice. And imagine the reaction to a physician when their patient shows up 30, 40 pounds lighter, and they ask, oh, you've done a great job, Mr. Jones. How'd you do it? Oh, my dentist helped me get healthy. The conversation will immediately begin at that point. So I'm sure a lot of you are out there saying, the dentists out there are saying that, you know what, I love the concept. It's a great idea. Altruistically, it sounds great, but I just don't have the time to do that. I'm a busy person, and I'm not sure I'm going to be able to do that. Well, you don't have to have the health professional be the leader in the practice. I mean, 80% of health coaches that you'll learn about are not health professionals. Anybody who has been trained can do it. And as I recognize in my many conversations, there is a person in the dental practice who wants to do more than just scrape teeth. I'm sure most or all of you hygienists who are out there want to make a difference. You want to have an impact, and you don't want to just scrape the person's teeth. Everybody says so. And this is a perfect way where you can have it, and you've got a captive audience as you're talking to them, and you can tell them that you can't do your job unless they get healthy. And just kind of an intro, there is a financial component to this, and if your practice is coaching 100 clients, then typically you'll get about $7,000 a month revenue to your practice. And I'm not sure how much it means to the dental population, but physicians love the fact that it's not involving insurance. There's no managed care. It's completely separate from that. It helps them kind of get them out from drowning behind the insurance companies. So the program's called Take Shape for Life. It's a 10-year-old program. Most of you probably haven't heard of it because to this point there's not been any advertising. It may not be the right thing for you, and if that's the case, it's perfectly fine. I mean, if I've kind of stimulated a little bit of sparked a little bit of a fire in you about the third era of medicine, if you think that you've got a third era mindset, then I will tell you in 22 years of medicine, this is the best tool I've ever found to help a person create health in their life. And not only that, you don't have to do it out of the goodness of your own heart. You can actually get paid for the work that you do. So what Take Shape for Life is a professional coaching program. What you would offer your patients, your clients, is a personal health coach. And it's a coaching program that empowers anybody who's motivated, everybody who wants to raise their hand and say, I want to get healthy and create health in their lives. I am not selling anything. I am not trying to convince anybody to do anything. I'm presenting the diamond, the precious jewel of a program that I have, and if they want to get healthy, this will work for them. And it's not a diet. You'll hear the word Medifast used, but this is not a diet. Diets don't work. 85% of people who lose weight will gain it back in 2 years because they never learn how to keep it off. What Take Shape for Life is a professional coaching program where it's coaching people through the weight loss phase and teaches them how to maintain the weight they lose. And one of the fun parts of it, we're a 10-year-old company, but a year ago in New England Journal of Medicine, there was published a wonderful article that showed that professional health, or that health coaching is effective. What this study did is that they took a group of people who were at a BMI average, body mass index average of 36, so they were into class 2 obesity. And everybody got the learning program. Half of them walked through it on kind of a self-learning approach, and the other half were either given a remote health coach or they were given a group session such as Weight Watchers does. And what they found was that those who had the health coaching, and it was the equivalent, whether it was remote coaching like we do or the Weight Watchers group approach, is they were significantly more successful at weight loss over a 2-year period compared to the people who were given the self-learning program and did it on their own. So they proved what Take Shape for Life has been doing for 10 years. So Take Shape for Life is a program that was developed by this man, Dr. Wayne Anderson. Dr. Anderson was a critical care specialist who was working at the Cleveland Clinic, and he got sick and tired of ushering people into death in the ICU because of the lifestyles that got them there. So he said, that's it, I quit. He left the Cleveland Clinic, a very lucrative job there, moved his family to the West Coast, and over a 2-year program, he wrote the coaching program and he wrote the learning program that's now Take Shape for Life. He's put together a fabulous business, a great innovative management team, scientific advisory boards, includes people from Johns Hopkins, Tufts, Baylor, and he's developed Take Shape for Life. Well, he recognized that it's great to have a coach, it's great to have a learning program, but that's not, people need a way to lose weight. Well, and going back to that New England Journal study, what that study showed was that after 2 years, the successful group lost an average of 10 pounds. I mean, these are people who are probably an average of about 50, 60 pounds overweight, lost an average of 10 pounds. So yes, they lost weight, but not much. So about the time that he developed the program, it was being proven through research that the meal replacement programs were fabulous at helping people lose weight. They were very effective at getting them to lose the weight, but they were diets, and as I said before, 85% of the people would regain the weight that they lost because they never learned how to keep it off. So the diets didn't work. So what he did is he partnered with Medifast. He did his due diligence. He did the research, and I've kind of looked at it with him, and he absolutely picked the best company out there. Where Medifast is it's a industry leader. They've been proven. It's been out for 30 years. It's the only meal replacement program that has the data to show that it's not just effective and fast, but it's also safe. It's got studies from NIH and Hopkins that prove that it's safe. So what he did is he partnered with Medifast as the weight loss part of his program, put it together with the coaching and learning system that he had developed, and that was the birth of Take Shape for Life. So what it is, it's a physician-led company. It's not led by the food industry. The leadership's been all physician-led. And it's based on the concept of helping people create optimal health through the use of a health coach, a learning system, and the weight loss phase. So kind of helping you understand the 3 cogs of the wheel, I'll first talk about the health coach. So everybody who participates in the program gets a human being, a personal health coach that you would provide through your practice to walk them through the program. The person is not teaching them anything. They don't have to be a health professional. 80% of coaches are not health professionals. What the health coach does is it's a tour guide. It guides them through the weight loss phase first, and it guides them through the learning system that's provided by the company to help them maintain their weight loss and lose their weight. And the coaching is free to the client. You'll learn later the business model, but the client doesn't pay the health coach a penny. The company pays the coach for the services of coaching. So the learning system that Dr. A has put together was case closed, the best learning system I've found. I mean, he is a very intelligent guy who's gotten very practical in what he's done. And what he does is he says that we need to teach people habits of health and to overcome the habits of disease that got them there in the first place. He says, don't tell people to break this habit or identify that bad habit. Number one, they're not going to want to do it. And number two, they're not going to recognize all their bad habits that got them there. So he says, teach them the good habits. It focuses on small, simple changes that they practice. They repeat them. They do one at a time, baby step by baby step, that walks them down the path towards optimal health and actually able to maintain the weight that they lost. Again, guided by the health coach. And the health-related topics, it's no surprises. It's all the topics we all know about, but nobody seems to be able to effectively implement in healthy eating, exercise, sleep, and yes, there is a approach to the psychological component of food addiction. So this depicts what we're talking about. Again, if a person starts off right here, and they basically through inactivity, poor sleep, lousy eating habits, they develop an inflammation, they lose muscle mass, and they get obese, and they get sick. So these are the habits of disease. And what Take Shape for Life does is it offers them the third era of medicine. It offers them that new health path. First, a fabulous method to get the weight off, which is sometimes very, very difficult. But then what it does is it teaches people step-by-step habits of health that lead towards optimal health. And what the program that Dr. Anderson put together has lots of tools in the toolbox. I use the toolbox analogy because basically a person who decides to choose Take Shape for Life are given a toolbox. And one of the tools in the toolbox is the health coach. The health coach hands them the toolbox, and the health coach teaches them how to use the tools in the toolbox, shows them the MetaFast 5-in-1 weight loss plan, shows them that there's a learning system, there's online tools, that there's phone calls they can go to every week and talk to a physician, talk to a nurse, and learn how to maintain your weight once you've lost it. So they've got these bio network of tools that teach a person long-term success. Just a moment on the MetaFast plan. MetaFast, it's in the news a lot, and honestly the reason is because Take Shape for Life is driving MetaFast to the top of the heap. You'll learn about it a little bit there. But MetaFast is a 30-year-old company that works for weight loss. What it is, it's called the 5-in-1 plan because what the person does is they have 6 meals a day. That's the most important healthy habit to maintain long-term is frequent fueling so that they're going to eat every 2 to 3 hours throughout the weight loss phase and for life. They're going to have 5 MetaFast meals and 1 lean and green. That's real food that they prepare. They're taught how to prepare and adheres to the guides of the program. And by doing this MetaFast, women typically lose 10, 15 pounds a month, men typically lose 15 to 20 pounds a month, and that can be long-term. The MetaFast meals are, I call it nutritional rocket fuel. It is man-made food. Some people get hung up that it's, oh, this is processed food. Well, that's because they're interpreting the food that the food industry makes that's processed. This is man-made rocket fuel because they take a long time, 2 to 3 years to make each product, to make them all nutritionally equivalent, that they're a good quality protein. It's not high protein, but they're able to have a full dose of protein in a small number of calories. It makes them full, a very good satiety index where they don't feel full through the entire program. They're easy to prepare. There's no vitamin supplements needed whatsoever. They're completely, they contain all the vitamins that they need. And as you'll learn, it's cost neutral, so all the client's doing is simply shifting their food dollars from the grocery store to Take Shape for Life. The lean and green I mentioned, it's real food. It's 5 to 7 ounces of lean meat. It's three servings of non-starchy vegetables. They can eat at home. They can eat in restaurants. There are vegetarian options, and the food is downright good, and it teaches people throughout their weight loss phase they actually can enjoy good food, healthy food. So I'm just going to take a couple minutes now to kind of walk you through the program to kind of give you a picture of what it looks like for the client. So in the years or decades prior to making the fundamental choice to get healthy, what the client does is the calories in exceed calorie out, there's fat accumulation. At some point, the person makes that fundamental decision, I'm going to get healthy, and I'm going to use Take Shape for Life as my tool to get healthy, and they start the MetaFast 5-in-1 plan. So what that is that people will have fewer calories that they need. They're consuming about 800 to 1,000 calories a day, which is not enough for anybody, but what that does is it opens up the stores of fat that they've been accumulating for years and years and gets them into a mild fat-burning state, where what they're going to do is mobilize that fat for fuel through the entire weight loss phase, which is how the program works, and the MetaFast allows them to do that. At the beginning, I don't tell people to worry too much about the habits of health at the beginning, but about 3 weeks into the program, after they've lost sometimes 10, 15 pounds or more, and they're getting kind of excited about this weight loss, they're kind of getting motivated to do what it takes to keep it off, and one of which is activity. At the beginning, kind of get them into good fat burning, they have to kind of back off a little bit on their intensity of their exercise at least. If they haven't started exercising, wait a little bit. But about 3 weeks into it, get into it, because that's where they start to learn the lifestyle part of it, and they get into the habits of health at a time where they're very, very motivated to do so. People always ask me, how long do they have to be on the program? Well, as you can imagine, it's going to take a lot longer to lose 120 pounds than it does to lose 20 pounds. It'll work for everybody, but what they do is they stay in that fat-burning state until they reach a healthy body weight of less than 25. And I will say, not a lot of people believe that they can. A lot of people don't believe they can get there, but they can. And I will say from a physician's point of view that I don't start to see those valine inflammatory markers, insulin resistance, cure themselves until they do get down to that healthy weight of about 25, where the visceral fat gets in the normal range. That's on beyond what you need to know, but that's the reality that is a healthy body weight. After they reach that, after they reach that point of 25, I sit down on the phone or my patients in my office. Most health coaches do the phone and say, this is a critical juncture. Congratulations, you got to your healthy weight. You've got two paths you can go down. You can let this be a MetaFast diet, and just 85%, like with all diets, you're going to regain your weight, or you can choose to take shape for life, learn what got you here, learn how to maintain it, and maintain your weight loss long term. So with the program, we don't dump people right back into their full allotment of calories at the beginning. There's about a 4-week transition zone where they go up to maintenance over time. And in maintenance, where they've got calories in and calories out. And this slide is the slide that connected me with the program when I first heard Dr. Nelson talk about it, because this is based on a study that I've been talking about for about 8 years before ever hearing about the program. It was a study done by the National Weight Control Registry where over 4,000 people lost an average of 67 pounds and kept it off for an average of 5.5 years. So a lot of people lost a lot of weight, kept it off a long time. You were really successful. They asked them a large battery of questions to find out what worked, and these are the common denominators that got them healthy. And Dr. Anderson calls it the Be Slim approach, Be Slim lifestyle for maintenance and take shape for life. I'm not going to get into the details of it. You can read it, but I will just point out that the reason I really like, as a physician, the MetaFast plan that he partnered with is that because they're eating real food throughout the entire weight loss phase, they're practicing every single component of the Be Slim. So if they haven't figured it out beforehand, when they get down to transition, they'll say, good news, you've been practicing the Be Slim lifestyle throughout the time. You just now have to apply it to eating non-MetaFast food. Oh, I didn't mention, everybody asks, is that when somebody gets into maintenance, they can choose to continue to have a few MetaFasts. Many do, but there's no requirement. That Dr. Anderson offers in his approach about 3 pages worth of 100-calorie healthy fuelings that they can have between their 3 modest-sized meals to keep that 68 fuelings a day that's necessary. So what does it cost? Well, as I mentioned before, if they're eating, for most people, it's free. The MetaFast component of their nutritional intake is about $300 a month. The lean and green typically costs about $60, $80 a month, so the total cost is about $360 to $380 a month to be on the program. The Bureau of Labor Statistics says that the average American, between on-the-go, eating out, and eating at home, spends about $440 a month, some more, some less. I've had a lot of people say that they're actually spending less money when they're on the program than they did beforehand. And as I mentioned, the health coaching is free because simply Take Shape for Life pays the health coach out of their profits from the sales of MetaFast foods to do for the health coaching services that we provide. So basically, I will have occasionally people say, you know what, I don't think that program's going to work for me. Well, the truthful answer is that if you do the program, it'll work. Physiologically, it has to work. If they adhere to the program, it will work. And you know what? The timing just may not be right for them. As I said before, I'm not going to twist anybody's arm to do this. If they want to get healthy, I'm there for them. So I simply say, what do you want? And that's kind of part of the approach to people, is to simply say, you know what? Keep your eyes on the goal. Keep your eyes on what you want. Because just like a potter has to work to create the pottery or the masterpiece, the sculpture that they're making, the person creating health in their life has to work to create health. So what Take Shape for Life does, it is a solution. It's a truly proven solution. It's a health path, a ThirdEra health path for those who really want to, who are intrinsically motivated, not because I'm telling them to as their physician, but because they want to from within, to assume the individual responsibility to create health in their own lives. And that's the key. That's the key to the program. It's all about creating health, and that's the target. The target's not weight loss. The target's creating health. This is Mary Ann. She's a patient of mine, and don't tell my other patients that she's one of my favorites. She for 15 years as my patient. And she really wanted to get healthy, but was plus or minus 10 pounds with that picture on the left, even in this hotty-toddy concierge practice that she joined when I moved over to this practice. But like most physicians, I didn't have the tools or the know-how to help them create health. So Marianne, when I first implemented this program into my practice, she raised her hand like Arnold Horseshack from Welcome Back, Kotter, and says, yes, 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 I will do it. I want to get healthy. And in the course of 11 months, the 74-year-old woman successfully lost 110 pounds. This picture on the right was in the late spring, I believe it was, and so she's been that weight for the last 4 or 5 months. And now I will humble myself. This is me. The one on the left was my wake-up call back in 2007 that my life had gotten out of control. So I did the first 25 pounds on my own by kind of practicing what I've been trying to preach, and then my first aha would take shape for life, where I thought that I was doing pretty well, and that last 15 pounds just melted off of me, and I was able to get to my healthy weight, and my 70, 80-year-old age range is going to be much happier, I'm sure, because of it.
Is that Mark Nelson by any chance?
Oh yes, that guy on the left there. This is Mark Nelson. He is the cardiologist who introduced this program to me, and he's a full-time health coach. He actually decided to quit cardiology because he was having so much fun in his practice. And I will tell you that as a physician, if I wasn't enjoying being a physician as much as I am now, I would have punched out and I'd be doing this full-time too, because the opportunity's there, and I just like what I'm doing as a doctor too much to do it full-time, but it certainly made it a part of my business plan. Mark, on the other hand, he was burning out, and his story is kind of fun on how it saved his marriage basically by getting out of the rat race of cardiology and being a full-time health coach. Okay. So if your patient wants optimal health, how are they going to get it? Well, the unfortunate reality is that they're most likely 80% chance they're not going to get it from their physician. So who's going to do it? Well, why don't you let it be you? So
thanks for the prompt.
Do you want to do the other poll we got here?
I do. I almost think it would have been interesting had we asked these before the presentation and after, and just to see if there's a difference. But I'd like to just ask everyone to give us a frank assessment. Are you, and Virginia, if you want to go ahead and present the poll, that would be great. Are you satisfied that yours is a practice offering oral systemic health to its patients? And just take a moment to answer that, and then we'll have a quick follow-up as well. And obviously we recognize that oral systemic health means different things to different people, and that will obviously have an impact, and it's a moving target as we learn more and are able to deliver more. But I suspect most of us on the call today have a sense of what it means to them to be an oral systemic practice. So let's go ahead and close that poll and see what y'all have to say. Okay, 25% yes, 25% don't know, and half believe that they are not currently. And again, a fairly, well, it's interesting that I think I'm encouraged by those who feel that they are. And let's go ahead and follow up with the next question, Virginia. And especially if you answered no or I don't know to this one, go ahead and close the poll, Virginia. And let's see the next one. So, whether you answered no, I don't know, or maybe even yes and you're not fully satisfied, what is holding you back from implementing a true and branding yourself as a true oral systemic practice? This question, by the way, is multi-answer because I don't feel that any of these are mutually exclusive. So just take a moment and consider this. And again, I think it would have been interesting to see before and after, because I know that what we're presenting is an answer to a lot of these concerns. Okay, let's close the poll and see the results. So that's very good. Everyone on here understands that it's important, so nobody stated that as a reason. 27% perceived lack of public appreciation of its importance. Fortunately, I believe that that is changing. And the time commitment necessary is also at 27%. And 73% want to know how to structure it, and 73% want to understand how to better monetize it. And again, because these are multiple answers, the total does not add up to 100%. But thank you all for sharing that. And
I'm not surprised.
yeah, let us. Well, with hope, we're providing some answers to those concerns.
Bear with me. It's not wanting to.
Just needs a little cajoling.
There we are. Make sure that's right. Okay. All right. So, along the lines of the survey we just asked, well, how can a dentist implement a ThirdEra dental practice focused on creating total body health, not just dental health? Just like I've implemented a ThirdEra medical practice, I've had there's physical therapists implementing a ThirdEra dental practice. Physical therapy practice. We're all health professionals. We all want to help those who are ThirdEra thinkers want to help people create health. So what Take Shape for Life offers is a solution not just for your patients to get health, but also offers for you that can offer a tool to implement it, and one that can actually not be done out of the goodness of your own heart, but you can actually get paid for what you do. That's what all health coaches get paid for what we do. Now, don't read this. Don't read this. I'm going to read it to you. I can imagine, and I've been told by a couple dentists saying, how on earth, I know how physicians can do it. You can talk to people about that. How on earth can a dentist talk to people about their weight? And it's a very reasonable question. So what I would like people to do is to close their eyes, and I'm going to read to you something I put together that these dentists that I know really like, and said, I can do that. So basically, you're talking about the program and say, Mr. Jones, here's a topic I'd really like to broach with you if you don't mind. It's really well established that it's very difficult to eradicate a person's gum inflammation if they have high blood sugar levels, even just prediabetes. Gum inflammation, we now know, can increase the risk of many systemic diseases like heart attacks and strokes. Well, I have a physician friend who's implemented a program that's been very successful. I've decided to implement it in my practice because I've been really kind of frustrated with the medical community because they haven't been better able to help people lose weight when I send my patients to ask them to do so. And then they really can't help them maintain that weight loss. So those results would really make my job much easier. So I've tried the program. It's surprisingly easy. Everybody gets for a personal health coach to guide them through the program. And if you're interested in creating optimal health in your life, we'd really be honored to be your coach. So that's just kind of a structure with which you can kind of open up the conversation, and you can even do things like talk to them about, I'm doing this program I love. Do you know anybody who would want to do it? The things that we talk about as we work you through the program. So let's look at the business model for a moment. So one of the things I was most impressed with is that this is just not just a great program, but there's a man named Dan Bell who built the business model who did a fabulous job. It's a very unique business model. I'm in a concierge practice. I was not willing to sell product out of my practice and cheapen what I do, and we don't sell products. There's no direct financial transaction between my patients and me. Basically, I'm paid by the company to coach my clients to health, and then you would be too. We don't carry products. There's really no significant financial outlay to get started. It's $199 to get started as health coach. I'll explain that in a few minutes. And the coaching revenue is not controlled by managed care. It doesn't have to go through the insurance. You're basically paid by the company to coach clients to health. The business industry is seeing how successful it is. In 2010, Forbes magazine rated Medifast as the #1 small company in the country. In 2012, it got in the top 10. And the reason being is that Medifast 10 years ago was a floundering company on the verge of bankruptcy, and now Take Shape for Life drives about 70% of the revenue for Medifast, which is why you're seeing so much Medifast out there. So the business model has been proving to work. A quick note is that one of the beauties of this is that there's a new CEO, even newer, in April of this year, who has just done a fabulous job on helping out new health coaches and is really going to be setting this up to take off more in the future. So you'd be partnering with a good company. So as far as health coaching, there are two levels of the business. The most important one that I'm going to focus on tonight is the Plan A, where basically you're focused on introducing the program to your patients and coaching your patients and basically creating revenue for your practice. As I said before, if your practice is coaching 100 clients, it's going to be a monthly revenue of approximately $7,000 a month. And just like the being a client is easy and you're fully supported by the company to be a client, with the bio network I discussed before, the same goes true for coaching. And where basically you're the health coach in the middle. Danny and I are business coaches that help you and duplicate our success in your practice, and you're given lots of tools to be successful. And this is where this new management team, this new CEO, in the last 8 months, the number of tools available to us is just amazingly good, and that it's so much easier now than a year and a half ago to get started as a health coach with the tools that they've developed. It's all professionally done and looks terrific. So here's kind of the financial structure of it, and just as an example, if you're coaching 30 clients a month, each person's paying Take Shape for Life about $300 a month to get the food. You're going to earn a revenue of about $40,000 a year. And you can see that it's not difficult. This is not a time-consuming endeavor. It takes about 30 to 60 minutes a day to coach all 30 clients.
Right. Not each client. We hasten.
So, yeah, not each client. It is for the all 30 clients. The reason is that they're learning from the company. They're learning from Dr. A's habits of health. They're losing weight through the MetaFast plan. The health coach is simply walking them through the programs, being their accountability partner and being their encourager.
Yeah.
And what you're doing is you're simply going to, usually the first week, until they can get into that fat burning state, you're talking to them each day, but once they wake up on a bad day 3 or 4 feeling terrific with lots of energy and sleeping better than they were before, even that early on, then you don't have to talk to them as much. It's about, typically at that point, we're connecting with them at least once a week, and either through email, texting, or a phone call, whatever they want to do. Busy people typically like to email or text. Others like to talk, especially if they're having any problems. And then basically it's about a 3 to 5 minute phone conversation if you do. So it's really not that.
What's interesting, what I find, and I know this is typical, Chip, is that really being a coach is almost what's adequate is the client knowing you're there. It's an accountability. It's knowing somebody cares and is a resource. I want to make sure people don't think this is at all like being a personal trainer where you have to stand over the person every time they do a sit-up to make sure they're doing it right. It's being there, and absolutely if people have concerns or questions, and we do encourage outreach. But it's funny. I mean, I think most of my clients, it's like, yeah, Danny, thanks a lot for checking in again. I'm doing fine. If I need you, I'll let you know. And that's pretty much
and honestly, and as I'm doing this, as I do the coaching, I recognize why that New England Journal of Medicine study is true. Because inevitably, there are a handful of people who have a difficulty getting into fat burning. Well, you're taught as a health coach how to triage that and help kind of get that person into fat burning.
Yep.
Everybody hits a plateau, especially if they're losing a bunch of weight. Everybody hits a plateau along the line, and that's where most people who are doing it on their own just give up and quit, or they get stuck at a BMI of 30, which is a classic plateau location I've seen for a couple decades now, and they just figure, oh, this is good enough, this is the best I can do. Well, we are given as health coaches 13 bullet points to help people through that plateau, and that's when you have even if you're texting or emailing them, you'll pick up the phone and talk to them and help them through that plateau. You're monitoring their weight each week. You're just asking them, sometimes, I mean, a week's encounter is an email saying, how you feeling, any problems, what's your weight, boom, I'm done. They email back saying, I'm 210 pounds, down 2 pounds, feeling great. Boom, that's the week's encounter.
Not being a dentist, what's downright fun for me is somebody thanks me and I can see the results, and they do, and they give me that gratification. Dentists, I'm sure, experience a very similar experience when they get somebody out of pain or they make them look more beautiful. But this is the kind of thing that, boy, it really puts a spring in my step when people thank me for helping get them involved in this, because it's that.
And Danny, that's exactly why I've made this part of my business plan. I mean, yes, there's a financial benefit, but it's fun. I mean, you'll see health professionals don't have to coach. I coach some patients just because I like doing it. So basically, getting started, I mentioned the health coach kit is $199 to get started. They're simply asking for helping to cover all the materials they're going to be giving you in your health coach kit, all the marketing materials, and a year's worth of their co-branded website. Everybody gets a co-branded website. This is Dr. Nelson's site here. That is tailored to you, is personalized to you, but they update with lots of information constantly all the time, so you don't have to maintain it. They do that for you.
Hey, Chip. Hey, I know I don't normally do this. I wait to keep the questions for the end, but Holly just asked, $199. Really? What's the catch?
The catch, Holly, is that they know, and all the materials they basically are giving to us at cost. Business cards is $24 for like 500 business cards, because they don't want finances to be a roadblock to get you started. They want you to be successful, because they're going to make their money by you being a successful health coach. So they want to stay out of the way as much as possible. So they're simply asking you to cover their cost for the materials, for the health coaching kit, and et cetera. Yeah, there really is no catch. They're not making money off of you. They're making their money from you're acquiring clients, and the revenue that they're getting from the sale of the food, which they feed right back into you.
I was likewise skeptical, by the way, at the beginning.
Yeah.
Because I've been approached with franchise opportunities. They wanted $30,000, $90,000 to build.
I remember that. Well, that's because in those companies right there, they make their money from the sale of the franchise. In this one, they're making their money from the work that you're doing. I mean, they're feeding you back some of their profit to do the coaching. Obviously, that's only fair.
Everyone's goals are congruent. It's great.
But then what ends up happening is you successfully coach somebody. They got a bunch. Just like I said, the dentist's office has a bunch of walking billboards. Well, Take Shape for Life. You don't see this advertised anywhere. Why? Because they don't need to, and they're basically the profits that Medifast is spending on advertising. Take Shape for Life is feeding the health coaching system and paying the health coaches to coach the clients, because they've got the walking billboards, and they're the ones kind of promoting the business and loving life as a health coach. Basically, Danny and I would show you. If people get a little bit nervous, how am I going to share the opportunity? We're going to show you how to do that. And basically, as a business coach, the business model is you would not pay us a penny. And now that's not a catch either, because yes, we are going to get paid. But again, the company pays us to help you be successful. The more successful you are, the more successful they are, so they pay us for it. And that's kind of the other level of business that we're talking about, being a business coach and a business leader. So you would not pay us a penny. And what we would do is we would work with you. We would help you get started, and I'll show you that in a second, that we would advise you regarding the best structure for your practice, help you determine who the point person is going to be in the practice, work with that point person, show them the tools the company provides, show you some tools that Danny and I have put together, and we'd also work with the health professionals who, like, even if the dentist isn't going to do any health coaching, many will choose to do it like I have, but if they don't want to, they need to know a basic understanding. So we'll work with the dentist also to kind of give them the basics of what they need to know so they can talk intelligently to the clients. Just quickly, 2 slides on option 2 that Danny have chosen to do. What we talked about before was being a health coach, and they get paid to be coaching clients. Business coaches sponsor health coaches and support health coaches, and we would support you fully. We work in teams. If somebody's on Danny's team, they get the services of Danny, me, Dr. Nelson, and a couple others. That we work in teams and help you out. And basically, by being a business coach, it allows me to extend my reach, give my skills by duplicating my success, by showing you the ropes. You will be able to coach clients that I may never meet. There's a limited amount of people I can help if I'm coaching them directly, but if I can empower Dr. Jones and Dr. Smith to be successful, or Janie, my 20-year-old not Janie, her name's Haley, I'll say. My 20-year-old daughter, who is a personal trainer, she's a health coach. And by helping Haley to be successful, she can do it. And there's a lot of health coaches who just do it because they're stay-at-home moms. They want to make some money, but not have to go to an office, et cetera, et cetera. So that's the concept of business coaching. So the bottom line is the question is how many lives you want to change. Dale, my nurse, she coaches 3 to 5 people a month. She does not want to make a business. Her husband makes plenty of money. She doesn't need the money, doesn't want it, but she wants to coach a few people so she can continue to talk the habits of health and maintain the 40 pounds that she lost on the program. And the bottom line is that the beauty is that there is no guilt in making money because every dollar we earn means somebody out there is getting healthy. So it all depends on how many lives you want to change. So basically that's the program. So if you choose to create a ThirdEra practice, dental practice, what can you expect the process to entail? Well, now don't get me wrong, a ThirdEra dental practice does not Take Shape for Life does not equal ThirdEra dental practice. But I would say, in my opinion, from the physician point of view, if you're going to implement an oral systemic practice, which functionally is a ThirdEra helping people to create health, you need a foundation of something, some program, be it this one, the Cleveland Clinic program that you NAOSH members have. That's nice. I talked to Dan Sindelar, and he says that basically they offer some nice tools, but it's not a meaty tool like this. It's not a human being that you can walk them through the program. So you need some sort of a mechanism to help people create health, and in my opinion, this is the best that you could offer. So basically, what's it look like? First step is you sign up as a health coach, you get the materials, you get the co-branded website. And the second step, consider trying the program yourself. If we've got 100 people on the call today, then the likelihood is that health professionals are not immune to the obesity epidemic. The likelihood is that 67 are overweight, and of those 67, 33 are probably obese. And everybody, all those are probably on the health paths, not really reaching what they want to have in the 70s also. So consider trying the program yourself. It's also very helpful, especially if you're going to do health coaching, to do the program to best understand the program. We'll present the program to your office staff. You can't do it. You don't know how to yet. Eventually, you'll get good at it. But we'll present the program to your office staff and let them try the program if they want to. You may find somebody who really loves it, and that's the person who wants to step up and do health coaching. You may find 2 or 3 people in the practice who want to do health coaching because they like it so much. And basically, we'll coach them. I mean, you're not expected to coach them from the beginning. They need somebody, so we would coach them. We can't coach everybody under the sun, but we can certainly coach people in the practices we're working with. And you can feel free to invite your family and friends to the program presentation. It's a shortened version of what I'm doing tonight. The next important step is to identify who's going to be the lead person in the practice. I'm the lead in my practice because I love it so much. But it can be anybody. I mentioned earlier it can be in the dentist's office. I think if the hygienist wants to do it, that's a perfect person positioned to do it for many reasons. And then we need to determine the structure. Not going to get into much of that, but basically the 2 options are to have all the practice receive all the revenue and then pay the health coaches to do the coaching. That'll give you the most upfront revenue, but there tends to be burnouts in practice if you do that route. And the better long-term financial model is to launch independent health coaches. All of us are independent health coaches. If you choose to do the business, you're not going to work for Danny and me. We're going to support you, but you'll work for yourselves. And the business model within your practice, if you so choose, is to launch your coaches to be independent health coaches also.
I think it's important to mention at this point, too, Chip, that where this differs from multi-level marketing, I think in a very important way, is that people in your structure, as you just set forth, even though they come on board after we do, if they work hard and are more successful, they will make more money than you or I will.
Oh, yeah. Yeah. The was it 35% of the revenue goes to the in the trenches health coach, and about 10% goes to the business coaching, business leader system. So it's the health coach is making the bulk of the money. Yeah, there's lots of reasons that this is not multi-level marketing to start with. Multi-level marketing, the work ends when the product is delivered. In our case, the work begins when the product is delivered. So,
right.
In terms of point 6 is that we will train your health coach. Whoever's going to be the point person, we're going to work with them. And we're going to offer them online tools. There's a workbook they can use. There's lots of tools provided by the company, a few tools that we've done. There's conferences where they can learn. But one thing I do encourage the business owners of the practice to do is to give the person who's going to do the coaching at least some work time to do the training. I think that I found that people are do a lot better job of doing their training if they're not able to just have to do it on their own time. If you give them a little bit of time on your penny to health coaching, and it'll give you plenty of returns in the end if they're doing a good job coaching. As I mentioned before, the dental professionals who need to talk about it but don't want to do the coaching, we'll kind of give them the skeleton version of what they need to know to talk intelligently. And there's the option if you want to do a lot of practices jumpstart or grow their Take Shape for Life business by having events in their offices, and we'll show you how to do that. So the last step is to show you, kind of give you a picture of what it's going to look like in your office. If you do this, what's it look like through the eyes of your client? Basically, you'll have some materials that you put in your office. It's not obnoxious. It doesn't have to be everywhere. You're not going to have food sticking out there to show people. You're just going to get a very professionally done DVDs, brochures that just show people the program, so to learn, see if it's the right thing for them. As health coaches, we input the first order. After that, it's all done. All financial exchanges are between the client and the company, but we put the first one in simply because a significant number of people mess up the first order, so we put the first one in or walk them through doing it themselves. The food is delivered to their home or wherever they choose. It's not delivered to our office. We don't carry products. As I said, I wouldn't do that. It goes to their home. They're given everything in their box to get them started. They're given that book that she's holding as the Quick Start Guide. It's the Rules of the Road, very easy to read, 20-some page brochure that shows them the rules of the road of the 30-year-old MetaFast 5-in-1 program, and it gives them the food for a month. As I mentioned, the first 3 weeks are focusing on the 5-in-1 plan. About 3 weeks in, we get them out walking and getting some physical activity going. We as health coaches guide them through all the different learning tools they have. There's tools for kinetic learners, for visual learners, auditory learners, and we show them how to hammer the nail. We show them how to saw the wood, but they actually have to do the work in learning. But we get to share in their success. So basically, what's the next step? If you're a dentist and you say, let's do it, I want to do it, I like it, we'll get you started. If you're a hygienist and you're saying, let's do it, I want to start it, well, obviously you need to get the support of the business owner, unless you're a hygienist who's kind of working on your own. And we can talk to the dentist, we can give them the overview. Don't you try to talk to them, we can do it for you. And you can give them a copy of this webinar that I'm doing to let them watch also if you're getting fired up about this and want to do the ThirdEra practice. If you're a little bit skeptical and or you're just not sure or whatever, try the program yourself. Be a client. There's no obligation to do health coaching from day one. If you want to, you can certainly do it simultaneously like I did, but try the program yourself, and that was my first aha moment. I got those last 15 pounds melted off of me, and then you can have your somebody else in your office try whatever you want to do. So, and if anybody else is on the line and it's not in those categories, just we'll talk to you and sort out how you want to do this. Bottom line is, it's all what you want to do. If you want to do it, great. If you don't want to do it, great. We're just here to help those who want to really just raise their hand like Arnold Horshack. Well, it doesn't have to be like I was. It could be just raising their hand to be a ThirdEra practice, or we can show you how to do it. Catch the wave to a healthy America.
Very good. All right, let's move right into questions, because we are rapidly approaching our end time, so to speak. I don't mean like the Mayans' end time. I mean the end of our presentation. But
in my opinion, you don't have to wait till after the 21st.
Yeah, that's right. Yeah, hurry up and get your orders in early. Mike asks if a program called Ideal Protein is similar to this. And I've never heard of it, Chip. Maybe you have. But at the same time, when you're answering that, maybe you could talk a little bit about how this compares to a very much bandied about diet these days called paleo diet.
The key difference is paleo is a diet. I can't say I know the other one there. I have not heard of it, but almost all of these things out there, they're a diet. They claim to have, Nutrisystem is a good example. Nutrisystem has a learning system. It pales in comparison to what Dr. Anderson's put together. But most importantly, they're given that learning system to kind of a do-it-yourself model, just like that New England Journal of Medicine showed, and those people regained those. They weren't successful if it was on their own. The health coach, which is where the rubber meets the road and the meat of Take Shape for Life is that we have a person who can help them through the getting into fat burning and help them through the roadblocks of plateaus they hit.
Mm-hmm.
So that's the big difference. This is a coach. This is not a diet. It's a professional coaching program paid through the sale of the foods. Absolutely, every business, whether you're selling computer software or widgets, the company, the sales clerk is paid through the profits of the sales. So, but this is a coaching service. It's not a sales program.
And this business, like any other business, depends on satisfied, happy clients who tell their friends.
So that's how you. And actually, that's a good point. People ask, well, how do I grow clients? Well, the best way is to coach people well, and they'll be walking billboards. They'll tell their friends, and they'll refer to you or be a health coach themselves. So.
Right. Now, Leanne asked this question. I'm going to answer this one because I think you did answer it at length, which was, do you recommend the practitioner and team first enroll in the program? And Chip did explain that that's important. And, you know, one reason it's really important is that it's always a lot easier to lead by example. When you're coaching and encouraging your patients to adopt healthy habits, it lends to your credibility when you're walking the walk. So I don't know if you want to add to that.
No, I couldn't agree more.
Okay, and so here's a question.
But actually, Danny, but I will say that you don't have to wait. Let's say you're a dentist or hygienist who needs to lose 60 or 80 pounds out there. I know there's unfortunate folks who are in that predicament. You don't have to wait until you've lost all the weight to be the role model. You simply need to be practicing the habits of health yourself and on the road to it. And then that's the biggest testimony is when the people watch their doctor getting healthy or their hygienist getting healthy, they're going to say, wow.
Well, that's an excellent point. You don't need to wait until you're where you want to be. People are going to enjoy, and you're going to enjoy sharing in the process with others. So that's a really good point, actually. Thank you. Sarah wanted to know if we could comment on concerns about soy, because there is
Okay,
soy.
yes, absolutely. Soy, it is a very bad-mouthed product. The concern that people have is that soy has a little bit of an estrogen effect. And the bottom line description is that there is a breast surgeon who does nothing but breast cancer treatment in my community here, who is sending us plenty of people from her practice in to do Take Shape for Life, because she says that the health that people create in terms of losing the weight and maintaining the weight far exceeds the theoretical danger of soy. And there's a beautiful, I forget what journal, but peer-reviewed study that shows that women who have had breast cancer who use a soy-based diet, which many of the meal replacements are, in order to lose weight, have fewer metastases of breast cancer than women who don't use the soy-based diet. So those were her two arguments on that. And with any of the concerns people have with the ingredients, like say I've had the analyzers, I call them, will try to pick apart every little ingredient in these. Yes, they're man-made. Yes, they have artificial flavors. No, they don't have artificial sweeteners, but it is man-made, and it's a means to an end. It's a catalyst to help people get what they want, health. I still have Benefast. most days. I'll have one. I love the bars. I love the shakes. I'll have one of those in between meals every now and then. Other people never have one. Once they get off the 5 and 1, they don't have them anymore. It's up to you. It's up to the person.
It's a very versatile program. So we are just about out of time, and I just want to save a couple of minutes at the end here to thank you, Chip, for such a thorough and important presentation, showing our attendees how they can, as we like to say around here, do well by doing good by adopting a ThirdEra medicine model for their practice. And of course, I encourage anyone interested in learning more to send me an email or visit the health professional site that you can access by the link that is on your screen. And
anybody, actually, any of those out here in my community who I directly invited, feel free to contact me directly. I'll work with you directly in your practices, since we're in the same community. And actually, most of those who I invited, we have mutual patients. I got your names from my medical patients because you're their dentist.
Absolutely. We are a team. If I get any emails, we know who got invited from whom, and Chip and I will work closely making sure that he follows up with the folks that want to hear from him.
Fun.
Please mark your calendars for Tuesday, January 15th, 7 p.m. Central Time, when our special guest that evening will be Jess Todfeld, #1 best-selling author, speaker, trainer, former national TV producer, and Guinness World Record setter, whose presentation, Getting the Media to Do Your Marketing For You, will present the keys to packaging yourself as the expert on topics ranging from aesthetics to dental sleep medicine to oral systemic health, and I guess I hasten to add to health coaching, to virtually any subject for which you possess a passion. In the meantime, this is Danny Bobrow thanking you for your commitment to practice perfection, and have a good night.